pain, headaches, and fever? Take one MedLemon hot medication in the morning and one at night to feel sharp again.
Whenever we have nasal congestion or we have a cough, we throw around words like cold and flu without realizing there's an actual difference. Today I'm talking to pharmacist Rakesh Sibarith, who'll be explaining the difference. Hi Rakesh, how are you?
Hi Ilse, I'm good, and you?
I'm good, thank you. People constantly throw around the words cold and flu. Is there a difference?
Ilse, yes, there is quite a distinct difference between a common cold and influenza or flu as most people know it. Both these viruses are caused by an infectious viral disease. With your common cold, your symptoms are confined more to the nose and the head or the sinuses. Symptoms with the flu can include fever, body aches and pains, chills, and fatigue. Normally, a person with a common cold can get on with their daily jobs, go to work, carry on with life. Whereas a person with the flu, they don't want to get out of bed.
What's the average duration of a cold and a flu?
Also, between the two conditions, with your common cold, your onset of symptoms normally appear 2 to 3 days after having contracted the illness. After about 7 to 10 days, a person should normally feel better. With the flu, about 40% of children can have a cough for at least 10 days, and about 10% of these children can actually go on for about 3 weeks. In adults, it normally lasts for about 7 to 10 days as well.
What products can we use to treat colds and flu?
Also, there are quite a few different products available for the treatment. Now, bear in mind, treatment for flu is twofold. Number one, to help you feel better, and number two, to fight off the flu. But just remember, there's no cure for the flu. Let's take a walk around and have a look at some of the products. One needs to choose the products that target your specific symptoms. Speak to your pharmacist to suggest a product with the ingredients that will target your symptoms. Products range from antihistamines or decongestants to help clear up the sinuses. You've got anti-inflammatories or painkillers that will help to bring down the fever, all those body aches and pains, especially you can't get out of bed. And then we've also got our cough syrups that will help for a dry or wet cough, and even your cough suppressants. Other products can also be added to that, something like a vitamin, especially high in vitamin C, and a product with some zinc in there. It has been shown that vitamin C and zinc can definitely shorten the course of your cold or flu bout.
How long should you treat a cold or a flu, and when is it time to pay your doctor a visit?
Look, normally after about 7 to 10 days, if your symptoms haven't gotten better or if they're getting worse, then it's definitely time to see the doctor. And there are certain symptoms that you should look out for yourself. Something like a fever that won't go away, is uncontrollable, or it won't stay down, time to go to the doctor. Uncomfortable chest pains or difficulty in breathing, difficulty in swallowing could suggest a secondary bacterial infection in the throat. There are numerous different symptoms that you need to look out for.
What basics should we have in our home?
Look, every household should definitely have a survival kit. For your main pain relief, you should look at products like paracetamol, aspirin or ibuprofen. But just be careful with patients suffering with either asthma or gastric ulcers. Neither aspirin nor ibuprofen is suitable for them. And also, children under 12 years old cannot use aspirin. It actually causes quite a rare syndrome called Raynaud's syndrome, which is a dangerous disease, but very rare. In terms of congestion, you could use products like pseudoephedrine or phenylephrine that are available in oral decongestants, or products like oxymetazoline or xylometazoline in a nasal spray, which actually work quite fast. And then, of course, your coughs. Everybody suffers with a cough, either a dry cough or phlegmy cough. Ask your pharmacist to suggest a product with either a mucolytic or bronchodilator, or maybe an expectorant, and especially for nighttime use, maybe a cough suppressant. Also, let's not forget about your vitamins. Definitely some vitamin C, some zinc, and also echinacea. Other things that we could keep in the household or even in your handbag or at work, maybe a hand sanitizer. An alcohol-based hand sanitizer definitely will kill germs, either left on the desk or by a handshake. Because germs, either from a cough or a sneeze, they're active for about 3 or 5 hours.
You mentioned earlier that we can't cure a cold or a flu. Now, in this day and age, where we can solve almost anything, how's it possible that we still haven't found a cure for something as simple as the common cold?
Look, the viruses that cause the common cold or the flu, they mutate very quickly, and they spread very easily. The proteins on the coat of the actual virus can change so quickly that by the time we try and formulate a vaccine to cure that virus, it's already mutated to form a different version of itself. So each time you get the flu in your lifetime, it's a completely different strain of that virus. The other thing is that once you have had one variety to it, you have formed immunity to it. Just remember that even though a cold is common, it's not simple.
Thank you, Rakesh, for talking to us and explaining the difference between a cold and a flu.
It's been a pleasure.
If you have any further queries or concerns on this topic, make sure you consult your healthcare professional.
Introducing new 18-pack MedLemon hot medication. Bigger pack, greater value. Feel sharp with MedLemon.